Hello viewers, welcome to another show on the Connect TV. Right now we have Dr. Isha Soni, who is in charge of the Lexicon Rainbiw Child Development and Therapy Center. Dr. Soni, please tell our viewers as to what is all this Rainbow project about and later and how you got into this. Dr. Soni.
Yes, so thank you so much for having me here. And I represent the Lexicon Rainbiw Therapy and Child Development Center. So just to give you a brief gist, so Lexicon Rainbiw Therapy and Child Development Center is a vertical of Lexicon Group of Institutes. And Lexicon Rainbiw was specially founded for children who have developmental delays or special needs. They have some, a diagnosis. And also we, take care of children who are otherwise neurotypical, but have needs like hyperactivity, attention span issues, or poor handwriting or speech clarity issues.
And, is this pan-India or Pune-centric?
No, this is Pune-centric right now. This is Pune-centric. But the pandemic gave us a chance to go pan-India as well as outside India. So we did through online therapy. Okay. We have reached to many countries, like more than 10 countries in during the pandemic.
Tell us as to how you got into this field, because many people who finish 10+2 get into the other glamorous fields of medicine.
Yes, yes. So, right from maybe as I was 14, 16, 18 years old, I knew that my inclination is towards children and I love working with children. And many times in the society, I did get a chance to see children who were not like others. They were different. And I really wanted to do something for them, because I didn't choose like what I wanted to do medical, that was sure. But what in that was something for me to decide on. And according to my thinking, I felt working with adults would not be so interesting as much as it would be with children. And, the work satisfaction which we get working with children is far more than what we will get working with adults. But when we work with a child, every child is different. So the boredom never sets in. I really look forward to come to my work every single day. I would especially like to, give you an example of the case study about a child who is diagnosed with autism. Okay. So, in our medical fraternity, we also call it is autism the new pandemic. So, because autism is on a very, very high rise. So, when I started my practice back in 2009, the incidence of autism was 1 in 110 children. So every one child in 110 children was diagnosed with autism. And now the latest CDC reports and the guidelines, they term it as 1 in 52. So every 1 in 52 child globally is diagnosed with autism. So it is literally doubled. And there can be many factors to it. And we are seeing, the contributing factors could be genetics, could be environmental triggers. And we have also seen more cases now during the pandemic. Because the child, all of us were inside our homes, but the child really lost and missed out on that social stimulation. And when both the parents are working, the child was doing nothing but left in front of a screen. So it was more of a one-way communication for the child, and the child never one-way entertainment, and the child never felt the need to communicate. And that has given more, rise in cases where we have seen children who had speech but have lost it. So yeah, coming back to the case study, we had a child who had come to us from Dubai.
Mm-hmm.
So the child is 3 years old, and he was diagnosed by autism. To give you a brief about the birth history, the child had absolutely normal birth history, was born full term, had good birth weight, motor milestones, that means crawling, walking, sitting, everything was on time. But what and where the child lacked was speech. Usually by 9 months, a year, the child starts addressing his parents. Like at least the child starts saying Baba, Papa, Mama. So that was not there in the child. So it took almost 3 years for the parents to take the decision to go and visit a developmental pediatrician. Also, it's a major tussle for the parents to take that first step of going to a doctor, because they often hear it from their parents or from neighbors or from any other well-wishers that, oh, even so and so spoke very late, it's okay, why are you getting paranoid, the child will talk, such things uh, prevents the parent from going to the doctor and taking that necessary help. So finally, this parent, they went. The child underwent a series of tests, and he was diagnosed with autism. But the therapy charges are exorbitant there in Dubai. And so the parent, they took a decision that they will shift to India. They had some relatives here in Pune, and the mother and the child shifted here to India while the father continued to work there to earn their daily bread and butter.
Yes.
And also, another major factor was the familial support. It is definitely not easy, taking your child every single day for therapy, running for follow-ups, for consultations. You definitely need a good familial support. So once the child comes to our center, the child undergoes a detailed assessment, because we need to map the child where the child is, whether the child in motor skills wise, where is he, like at what age of skill development is he. Chronologically he's 3 years old, but in speech, so this child who had come to us from Dubai, he was 3 years old, but his speech was only of that of a 6 month old baby.
Oh.
So after doing the detailed assessment and mapping where the child is presently, so there is a difference. We say developmental age and chronological age.
Yes.
So developmental age is more according to the child's present development, what is his age, and chronological age is how many years old the child is. So we had to cover that big gap.
So tell us about this child, Dubai child.
Yes. So then we started occupational therapy. So occupational therapy also deals with sensory issues. So this child had lot of sensory issues. He was very fearful of movement. He was very fearful of movement, means like swinging was like a terror for him. He would not sit on the swing. He would not like his feet to be off from the ground or from the floor, because he had a very poor sense of where my body is in space.
Okay.
He had touch hypersensitivity, so he didn't like anybody else's touch. So the day-to-day routines of bathing, changing clothes. He also had oral hypersensitivity, means he was very choosy about the food textures. So the child is 3 years old, but he's still having, mashed food. So this is detrimental to
he
his.
doesn't know. He didn't know how to chew.
Yeah, so this is detrimental even to his nutrition per se, and it becomes very cumbersome for the mother to prepare every meal for the child. Also, touching. So he would not like anybody else touching him. and the daily routine of bathing, or the monthly thing of hair trimming, weekly routine of nail trimming
What
used
about
to
the
be very, very
washroom
stressful.
habits? Washroom habits.
No, he was not toilet trained either. So my approach for him was that I should give him his space. If I force myself on him that okay, now you have to do these 5 things in my session today, he is not going to come to me from next time. So it is very important for us to make and create that safe space for the child and put him on the swing.
Yes.
So it was a long journey. He underwent twice a week of occupational therapy, twice a week of speech therapy. Speech therapy mainly emphasizes on language and communication development. But what we are seeing, language and communication is just the tip of the iceberg. There are other oral issues present in the mouth. So, the child is not comfortable moving his tongue. He's not liking the food textures in his mouth. So, that kind of, they are like obstacles for a proper speech development. So, the speech therapist starts working from the scratch with the child. And then gradually in 3 months' time, 6 months' time, we start seeing changes in the child. They are very minor, very subtle changes, but then it brings us and the parents a lot of happiness that yes, there is light at the end of the tunnel. That is the approach, or that is what a parent feels.
And for how long this child was with you, this Dubai kid?
So yes, so he just went 2 months back in January. The child finally went back to Dubai. So he had come to us without speech, with very high sensory issues, afraid of movement, not talking at all. To now, his sensory issues have reduced. He enjoys playing in the garden. He likes connecting with other children of his age, and he can speak at the minute. At the moment, he can speak 3-word sentences also. So, he can communicate his needs and wants, which is very important, rather than us just doing guesswork as to why my son is crying. So, he attained speech and he reduced his sensory issues, and now he likes connecting with people around him. So, it was 2.5 years of journey.
Okay. And is this problem more common among the premature children, or it can happen to anyone?
It can happen to anyone. So, like scientists are still finding the exact cause of this, but of course, genetics do play a role in this, and there are certain trigger points, as I told you. So, it can, instantly tick in autism in the child. It's a neurological or a neurobehavioral condition.
Okay, but do these kind of children have a different behavioral patterns at different times? For instance, of course, they may not be saying mommy and daddy, but in certain things like foods, they identify, they pronounce well, and certain words they don't. They still blabber, but certain words they pronounce well. That kind of mix.
Yes, so the irony is you can make them learn long shlokas. They will do that. They will know, like their rote memory is excellent. But the challenge is for them to communicate needs and wants to address us. So, imagine a child is not saying mama, but he can tell you everything about rhymes, about Gayatri Mantra. So it is very, very surprising.
That's what. Does it happen also because of lack of company, as you said, because of this the pandemic? People could not go out.
Yes.
So does taking children to the peer group, playing out, help a bit?
Yes. Yes, of course, because it sets the whole circle of communication.
Yeah.
If I'm only with a screen, I'm not talking at all. Whereas if I'm placed with a child of my age, I'm supposed to share my toys, I'm supposed to look at him, I'm supposed to communicate with him or talk to him of what I want versus just watching all the YouTube videos.
No, this process of I'm supposed to talk to my peer group, I'm supposed to share the toys, supposed to play. Does somebody have to instruct him, guide him, or does it come automatic?
So in a child who doesn't have autism, it comes automatically by looking and learning and observing other children.
Okay.
But with a child who is susceptible to develop autism, it doesn't come automatically. And once the child is diagnosed, we also work on, an occupational therapist also works on the play skills of the child. So that is something that we have to teach him.
Is your course, I mean, the therapy is available online even now?
Yes, they are available online. They are still available online also, because all these therapies and professionals, be it occupational therapy, speech therapy, these are not available in the rural areas of India.
Yes. Yes.
It is very much still a metro thing. So, like, you know, the cities in India like Mumbai, Calcutta, Pune, Bangalore, Delhi, Chennai, Ahmedabad, these are the places where there are therapy centers with good professionals. But if we go into, you know, interiors, then it is still a struggle. So this helps the parents to reach to us.
No, even in big cities also,
therapy.
even in big cities also, people may not be able to travel all that. So, but and what is the process? You go to the Lexicon Rainbiw site.
Yes, so you can go to the Lexicon Rainbiw website, www.lexiconrainbiw.com, and over there, there is a button to contact us. There is a, like, you know, call to action button for applying for online therapy also, or even enroll the child for a child development center program.
How big is the field? Because as you said in the beginning, the challenges are growing, you know, by the day and by the year.
Yes.
And how big is the field, and what is the range of problems that you come across?
Oh, so just now we just spoke about autism. The field is very, very big. Yes. But then the other developmental issues, of course, premature babies. Premature babies are there. So, you know, they are high risk infants. So they are very much prone to having delayed development.
Yeah.
So this is one. Then there are many children who get seizure attack, fits, what we call as convulsions.
Convulsions.
So even their development is hampered. So, you know, even they need these specialized therapies. Also, we get to see a lot of children facing academic difficulties. So we call it as the learning difficulties. So, you know, they have difficulty reading, writing. So reading is dyslexia. If the child is having you know, difficulty writing, it is called dysgraphia. If a child has genuine difficulty in mathematics, it is called dyscalculia. And yes, I would like to you know, alarm the viewers that not every child has this. It is with a child who has normal IQ, is very good in other things, but particularly struggles with either of these academic tasks. So then, you know, then they are further referred for the testing and therapies. We also have children with ADHD, that means attention deficit hyperactivity disorder.
Yeah.
So they have attention span issues, or they are extremely hyperactive. And then there are other children with chromosomal or genetic abnormalities like Down syndrome, Angelman syndrome. There are many such different syndromes which are caused due to chromosomal defects.
Now, what is your advice to parents?
Well, my advice to parents is recognize it early. I cannot, you know, emphasize enough about early intervention. So early intervention is very, very, very crucial for the child. Most of the times, we as parents, we are in denial that, oh, there's nothing wrong with my child. You know, just let us wait. Let us have some patience. Or, you know, we attribute it to genetics. That, okay, yeah, you know, my child's father also spoke very late, so even he will start talking automatically. But things don't happen automatically like this. It is a matter of crossing the bridge, that, you know, when you are in denial to acceptance. because ultimately we as parents are entrusted with this responsibility to guide our children. So if we are in denial, nobody else can help our child.
So it's quite a challenge for certain parents, particularly in the pandemic era,
Yes.
weaning away children from the screen because they got used to TV and mobile so much. Taking them away from that becomes a big challenge, and they throw tantrum, they cry. Suppose you're feeding
Yes.
him, he won't accept food until you give him the screen.
Yes. Yes, so I would like to cite a case study over here, wherein I had a child who had come to me around 3 years, 4 months of age, and he would just not talk. And the child psychiatrist referred him to our center for therapy, saying that he looks like a case of autism.
Okay.
What we did was, and even the psychiatrist recommended to the parent that stop his screen completely.
Okay.
And of course, gradually they started reducing his screen time from 8 hours to 6 hours, 6 hours to 4 hours. And we started therapy also. Within 4 months, the child was just like any other child of his age. So it was actually the screen addiction that the child did not communicate, or he lacked in all other things. So it was what we call as virtual autism, that he actually didn't have autism. His brain was not wired differently, but because of screen, he appeared to have autism.
This kind of screen habit, for instance, he's used to viewing certain rhymes, certain kind of music, certain songs on the screen. But when you put him in the classroom scenario in front of the screen, he would react differently. He won't.
Yes.
Screen is different for him.
Yes, yes. And of course, it's about your way, or your way or my way. It is like that. So I want to do what I want to see in that particular sequence. So maybe first I see Twinkle Twinkle Little Star, and after that I see Old MacDonald. So I don't want anybody to break that sequence also.
Almost coming to the end of the discussion, the name Rainbow. Why? How the name was thought about?
Okay, this name is thought about because every child that we get is different. So like that, a rainbow is an arch of 7 different colors, each one with its own shade, yet beautiful. So the same applies to our children, that each child has their own shade, but yet is beautiful in his or her own way.
Nice talking to you, Dr. Isha Soni. Superb. It is very enlightening discussion. And I think our viewers also will be very happy to know more about it. They can obviously log into your website. I'll play the thing and put on the scroll here. So they can go into the Lexicon Rainbiw.com site, and you get the benefit of the knowledge and experience from. Thanks.
Definitely. Thank you so much.